When you think of feeding your child, what comes to mind? Life. For every infant and child everywhere, food is life. Love. In the spoonful that a father or mother feeds their child, food is love. Joy. In the laughter of children sharing snacks, food is joy. Community. In the feast cooked for a family, food is community. One of the greatest challenges faced by our generation today is malnutrition. In both undernutrition and overnutrition, unhealthy diets are among the leading causes of disability and death. As a result of this, there are global strategies in place to improve the nutritional status, growth and development, and health of infants and young children through optimal feeding. Hi, I'm Dr. Aadil Khan. I'm a medical doctor in private practice. I'm certified in Pediatric Advanced Life Support by the American Academy of Pediatrics. Our topic of discussion today is feeding through illness. Sick children may not like drinking and can lose large amount of body fluids when they have fever, vomiting or diarrhea, or with lots of sweating. When the body loses more fluids than you can take in, it does not have enough fluids to carry out normal bodily functions, and this results in dehydration. Dehydration is especially dangerous in young children and can be caused by severe diarrhea and/or vomiting. Some of the signs and symptoms of dehydration in an infant or young children are dry mouth and tongue, no tears when crying, no wet diapers for at least 3 hours, sunken eyes and cheeks, sunken soft spot on the top of the skull, listlessness or irritability. What is the solution to this? It is essential to encourage a sick child to drink as often as possible. Water is the easiest choice, but if a child won't drink, juice can be added to liven it up. Some juices like orange juice can irritate a sore throat. Apple or grape juice may be more soothing, but should be diluted so that your child gets less sugar. If your child is dehydrated, these juices may not be the right choice of fluids due to their salt or sugar content. In these situations, oral rehydration solutions may be a preferred choice. For some children, warm beverages are soothing and it can help break up mucus. Milk is fine for kids with colds and flu and won't cause a mucus buildup. Despite what you may have heard, the protein and fat in milk can help a sick child maintain their strength. If your little one does not want to drink, then parents need to be creative. Make popsicles, put juice in a bowl and make them eat it with a spoon. Basically, try any tricks to make it more interesting. Infants and children are very susceptible to problems of nutrition. In comparison with adults, children have lower percentages of muscle mass and fat and therefore have fewer reserves and a higher resting energy expenditure. For this reason, children have an increased risk of developing malnutrition when they suffer serious illness. A sick child can lose a lot of energy due to a poor appetite from the disease process itself or an increased body temperature, such as a fever. Energy requirements are dependent on the different phases of illness, that is, the acute phase, the stable phase, and the recovery phase, and may be affected by the severity of illness and by other factors such as sedation, muscle relaxants, mechanical ventilation, and fever. One of the fundamental roles of nutrition in a healthy child is to enable growth and development. In contrast, the critically ill child uses nutrients principally to defend the body against disease, and even if a high energy delivery is provided, the body is not able to use this for growth. In critically ill children, optimal nutrition intake can improve recovery. It is very important to encourage a sick child to eat. This can be difficult as children who are ill may not be hungry, but you should keep offering them foods that the child likes, a little at a time, as often as possible, including breast milk to infants. Extra breastfeeding is especially important since it can provide nutrients required for recovery from infections. Frequent small meals are easier to digest and will help meet their energy needs. Stay clear of rich, fried, greasy foods and lean towards simple starches such as rice and noodles as they are easier on the stomach. Try bananas or toast if they are a bit nauseous. If you get in some vegetables, go for it, but focus more on getting them nourished.